Hi, good morning to those of you in the European time zone. Good day to everyone else. My name is Emily Hemmings. I'm Manager of International Cooperation at ERTICO ITS Europe, and I have the privilege today of moderating this webinar on the very hot topic of management of public transport to contain COVID-19. Attendees, welcome. You are muted, but you can address your questions to the speakers via the questions tab of your GoToWebinar application. So this webinar is part of a series of webinars that are being hosted by the ERTICO Academy, which is a ERTICO partnership initiative about sharing experience and knowledge across different actors and sectors by developing training courses. We already have 10 training courses online, and we've run a number of in-person trainings, most recently on ECMR for Turkish public authorities. And these resources can be accessed via ertico.com/academy. Back to today's agenda, COVID-19 is presenting unprecedented challenges for public authorities and public transport operators across the world. And the solutions and experts in the sector from UITP and from 3 cities, which are working together in the framework of the Solutions Plus project, have agreed to come together today to present about how these challenges are being addressed in Europe and in China. So allow me to briefly introduce our speakers for this webinar. We have Mr. Nyochar Seru, Statistics Manager for Knowledge and Innovation at UITP, Xu Yong, Vice President of Eastern Airports Co. Limited in Jiangsu Province, Sergio Fernandez Balaguer, International Project Manager EMT, Municipal Transport Company Madrid, and Britta Ulrich, Head of Change and Innovation at Hamburger Hochbahn. Thank you to all of the speakers for joining us and for sharing your experiences. Before passing the floor to the speakers, I will briefly introduce ERTICO and the Solutions Plus project. ERTICO ITS Europe is a partnership of about 120 public and private organizations from across the ITS ecosystem. We are working every day together with our partners to develop, promote, and deploy ITS systems and services through a variety of activities, including international cooperative projects in 4 main areas: connected and automated driving, clean mobility, urban mobility, and transport and logistics. A lot of our activities are in European co-funded projects. On average, we're running between 20 and 25. And in addition, ERTICO hosts 8 self-funded ITS platforms with regular meetings, workshops, and events. ERTICO is the organizer of the annual ITS European Congress, as well as co-organizer with ITS America and ITS Asia Pacific of the ITS World Congress. We also support other ITS congresses throughout the world. Another initiative I wanted to highlight is the recently launched ERTICO City Moonshot Initiative, which is a study for which we're reaching out to establish relationships with cities around the world to gather information on the needs and plans in key areas, including sustainability, data sharing, and mass implementation. We'll be collecting survey input. Our aim is to generate a better understanding of the reality and implementation plans in cities to be more impactful in bringing more of these technologies to the market. And we're reaching out to 200 cities in Europe and 100 in the rest of the world. This was my introduction to ERTICO. Moving on to the project which has brought us all together today, Solutions Plus. Solutions Plus is an EU-funded 4-year project which began this year, 2020, aiming to assist in the demonstration and uptake of e-mobility solutions for sustainable urban transport in the EU and the rest of the world, with a focus on developing countries. It was designed in the context of the Paris Agreement, the Sustainable Development Goals, and the New Urban Agenda. It will deliver innovation and integrated e-mobility solutions tailored to the needs of the cities involved. The consortium are establishing 10 living labs around the world in the cities which are highlighted in dark green on this map. And the living labs are developing a range of tools, methods, and guides to develop a toolbox on e-mobility solutions across all nodes. Over the coming 4 years, the project team are working to facilitate exchanges and partnerships among city officials, transport operators, and entrepreneurs to share their experiences on specific technologies, measures, business models, and financing solutions. And we're working to initiate partnerships between local and European companies to develop business models and provide support in the implementation of e-mobility solutions. We'll also be working to replicate these e-mobility solutions in other countries. The project is encouraging solutions focused on shared and public multimodal transport modes, covering different types of vehicles listed here, 2 to 3 wheelers, electric buses, etc., and also their operation and integration infrastructure, such as seamless charging and eco-routing services. This was a very brief introduction to a large and complex project. A lot more information can be found on the project website. The link is just at the bottom here. Back to today's agenda, we have 4 presentations, following which we'll discuss your questions, which we encourage you to write in the questions tab. And I will read your questions to the speakers to be discussed in that session. This webinar is being recorded, and the link will be sent to attendees. So if you if you wish to share with your colleagues, you can please do so. And with that, I will hand over to Mircea to start our expert presentations.
Hello everyone, can you hear me well? If you show me a thumbs up, I will just already go to my presentations. Okay. Okay, so as Emily has said in her very kind introduction, I work for UITP, the International Association of Public Transport, and I understand that most of you have at least heard of my organizations. Some of you are also member companies, but in case you haven't, I'll just give you a brief introduction to what UITP is doing, and I will keep this very, very short, but just so you understand where I'm coming from. And then I will make a brief overview of how public transport operating companies have reacted to the crisis which we are sadly having to face in all of our cities and communities. So UITP is an international association with more than 1,600 companies. Okay, with our main headquarters in Brussels, but we also have 16 regional and liaison offices worldwide, which means that we do gather quite a broad spectrum of the public transport sector worldwide. So in terms of reaching out and gathering experiences, we do cover examples from all over the world. So as the crisis of COVID-19 started appearing and manifesting itself all over the world, the very first thing that UITP did was to publish a fact sheet with guidelines for operating companies. And this was launched in February 2020. So I'm mentioning this to understand where we were in terms of the depth of the crisis. So basically our main recommendations was in terms of a public transport operator, how they needed to activate their business continuity plans, which most companies would have one anyway, how they should be adapted in order to deal with respiratory disease. And since this fact sheet was launched, it was already translated into 8 languages, and you can find this on our website. You're more than welcome to take it. If you're looking to have a version in another language, please get in touch with me, and we will arrange for a way. So then once we launched this this fact sheet, which has been relatively well received by our members, we've seen that quite a lot of operators have already have taken measures to respond to the crisis. So what we did was, through this network of members, we have put together harmonized set of questions which we've been asking of all of our members. So what I'm going to do for the next 4 slides and maximum of 5 minutes, so I give you a little bit of time to ask some questions if you want more information. I'm gonna guide you through the 5 main themes in which we've seen actions from operating companies. So these are in no particular order, but I did put in several bullet points. They are staff protection. So companies and public transport operators will have responsibility towards their staff primarily, and quite a lot. And in dealing with the responsibility to staff, they have separated and limited contact wherever possible between staff and passengers. Wherever possible, they've designated critical categories, and for all the others, they recommended or enforced working from home. Trainings and external events have been postponed. Common areas such as canteen, depots, workshops have been adapted so that social distancing is respected. Masks and gloves were made available, but their wearing is not yet mandatory within all operators, but everyone is providing wherever possible the gear. And then workstations, shared spaces are being disinfected wherever possible. The second area where we've seen quite a lot of activities from the operators is in terms of the riders. So who is riding the services? Basically, by now, following all of the communications coming both from the operators directly and from governments and authorities, basically ridership is down absolutely everywhere in some places, and I'm pretty sure you're gonna hear from the other speakers coming after me. Ridership is down even 95% in some cases. In some cities where the lockdown has been less strict or where measures start to be relaxed already, ridership would be down by 50%, but in generally it is down significantly. Service, however, has been kept up. It's more than 50% of what is considered to be a normal working day, because the requirements on operators have been to provide services so as to allow social distancing to happen on vehicles. Also, we've seen basically all of the operators that we've been in touch to putting in place strong communication campaigns, both to staff and also communication to passenger, which are primarily don't travel, observe social distancing wherever possible. Operational adjustments have also been put in place. So these were reductions in service where lines were no longer used. Also, we've seen that a diminution in schedules is also acting as a disincentive to convince people not to travel, because if you're still keeping all of the services, people will consider as essential even travel, which really isn't. Also, wherever possible, automated door opening. So there are little details which have been put in place to make sure that the what are called the pain points that help spread the virus are being taken into account. And apart from that, almost all of the operators have stepped up and have introduced and revamped their cleaning procedures. So even disinfecting per se, every single operator will have a protocol for how vehicles are being cleaned, when, and the schedule. But many of the operators were just using regular cleaning products, or they were subcontracting services for regular cleaning. So all of the procedures have been stepped up, new products being used to make sure that this particular virus, which is being fought right now, is being killed by what is being used in vehicles. So with this, I'm going to stop. So I give a little bit of time for questions. I'm conscious of time. I just want you to leave you with a public campaign which we've been running, and in which we are profiling operators who have been on the front lines and who, despite the critical conditions which we're facing, they did keep on providing services. So we have a campaign called Guardians of Mobility, and we are profiling some of the main operators and how they've been working to fight the crisis. So thank you very much. If you have questions, I'm open, and I'm waiting for the for your questions and for a live debate. Thank you very much.
Thank you very much, Mircea. We haven't had questions from the audience yet, but I have one. These new cleaning procedures, they would require new trainings and these sorts of things. Have you heard feedback on how difficult it was to implement brand new procedures in such a short period of time and for this crisis?
Well, quite a lot of the companies actually are so they are companies which are specialized to do cleaning. So you have to remember that public transport is not really the only place where disinfecting has to happen. So if you have a company that's specialized on cleaning, it will probably bring their procedures from different spaces which are being disinfected and then adapted to public transport. And also many of the products being used, they do come with specific procedures on how the product should be used from the company. So we've seen quite a lot of trials being performed where the cleaning is being done in conjunction with the company producing it. So they provide the guidelines and they actually help the operators implement the product the first few times to make sure that the concentrations are right, to make sure that everything is working well. We do have quite a lot of examples. I'm quite sure that you've seen it in the media where MTR Hong Kong has introduced a robot as well, which is helping out with the cleaning. So I'm not going to go back to that. You can search for the video, but yeah, we have quite a lot of examples. Also, what's being done, and that's specifically taking into account the public transport sector, is more frequent airing. So when you have a public transport line which normally would have a break for, I don't know, about 10 minutes or something like that at the end of a run, doors are going to be open and everything is going to be put in place to make sure that air is properly circulated through the vehicle at these particular stops at the end of the line.
Okay, we have a question on are you already preparing after COVID-19 period for what sort of measures will remain after the current situation? What would be the long-term impact? Maybe that's a question we can discuss together at the end, actually, because I imagine all of the speakers might have some perspectives on that one. Okay, maybe we move on to the next speaker and we can discuss that at the Q&A session at the end.
Thank you.
So, Mr. Xu Yong, you ready for us?
Can you hear me? Hello. Good.
Yes, we can hear you.
Okay. Hi, everybody. My name is Xu Yong. I am the Vice President of Eastern Airports Company, which is jointly owned by Jiangsu Provincial Government and Nanjing Municipal Government. There are 7 airports operated by my company. The biggest one is NKG, Nanjing Airport, with a passenger volume of over 30 million last year. One of the very important characteristics of containing virus COVID-19 is China central government and the provincial government issued the guidelines for containment against virus at the very early stage when the outbreak happened. China Civil Aviation Administration, also at the central government level, publicized the containment guidelines for aviation industry, recommending the procedures and the methods for airlines and airports. By following these guidelines, the airport authority has done 4 things. First, the temperature of all staff working on the airports are strictly measured every day and in a controlled procedure. One with the temperature over 37.3 degrees must be sent to the fever hospital for further checking. The staff must also report their and their family members' travel records within 14 days prior to returning to their work. Second, all passengers must be measured with the temperature when entering or leaving the terminal. One with the temperature over the limit is also sent to fever hospital. And those closely contacting with the passenger in the cabin are sent for isolation. The third, the airport authority, working with the local government team, sent to the airport for the purpose of identifying passengers needed to be quarantined, keeps the airport terminal clean, killing virus with the chemical stop, enhances more fresh air in the terminal by running the ventilation system, and dispose properly of all rubbish out of the tank. Fourth, the airport authority use all the multimedia instruments to tell the passengers always wear a mask in the public areas, wash hands often, and keep social distance. Presently in China and in Jiangsu province, virus outbreak has been finished. The communities has come into basically normal states. Now the airport authority is working with local government tightly on preventing imported virus cases. All inbound international passengers must be quarantined for 14 days in Nanjing. That's all. Thank you. Anyway.
Thank you very much for that overview. Maybe we should move on to the next presentation and then we can discuss the questions together at the end. Sergio.
Can you see my screen? Yep. Okay, yep. Let's go for it. So I just need to hide. Oh, that's it. Okay, so let's go for it. I will put the 10 minutes. I will try to be quick. So in the presentation, well, first of all, I would like to introduce what's EMT. So EMT Madrid is the public transport company of the city, is owned by the city, and we are a mobility operator. So our main mobility service is the bus, the urban bus. We are the biggest public bus company in Spain with 2,076 buses and 212 bus lines across the city. But we also manage the cranes for parking enforcement, the underground parking facilities with 23 of them and 11 parking lots, the bike sharing system, the public bike sharing system with more than 2,400 pedelecs, electric bikes, and also the cable car. And just to give you an idea of the amount of passengers we have on a normal day, so before the crisis, roughly we transport 1.6 million passengers per day in our buses. So the situation and evolution of the COVID-19 in Spain is quite dramatic, as you may know. So at the moment, Spain is the second country in the world with reported infected cases, with 169,000 infected people, and in terms of casualties of deaths, it's the third in the world at the moment. So the first case of coronavirus in Spain was confirmed in February the 1st in Canary Islands, and the second one in Palma de Mallorca, another island, in February the 10th. And then on the Peninsula, the first death was reported in March 3rd. And from then, well, you can see the figures there. Madrid at the moment is the region in Spain with the highest number of reported infections and the highest number of deaths, unfortunately. More precisely, at EMT, our company, we have 9,800 employees, and so far, unfortunately, 2 of our colleagues in the company have died. So the chronogram, the evolution, well, since the first week of March, some recommendations were launched in order to avoid crowds. More specifically, in March 11th, the Madrid regional government advised elderly or sick people to avoid using public transport. And also from March 11th, the school activity stopped. So that was quite a moment in which public transport use reduced quite a lot. Then in March 14th, the national government declared the alarm status, including forced confinement, until April 26th so far. So it's quite likely that this confinement will be extended until early May. And also all these recommendations on reducing mobility were started previously. And then between March 29th and April 13th, so until yesterday, also the national government set this economy hibernation. So just essential services such as emergencies and sanitary and food could work. So the reduction in March 11th in public transport was 48%. Here you can see the official the data from the national government. So you can see the red arrow, how public transport decreased sharply, both within the city borders, with the commuters as well. And the demand in public transport on EMT buses dropped down more than 90%. So as example, 93% last Sunday, April 12th, with just 35,000 passengers. If we go to a Labor Day, we are moving roughly 125,000 people per day compared to 1.6 million people. And this is also some data coming from this Google COVID-19 community reports, which shows also the type of trips that people is doing compared to the baseline. So mostly you can see grocery and pharmacy before the alarm status, and also parks before the confinement was declared. So people try to take advantage of open spaces, but since then, is basically very, very little all the mobility within the city. Some consequences: air quality, NO2 has dropped dramatically, which is a very good outcome. Also noise, considering that it follows a logarithmic scale. And down on the slide, you can see the concentrations from satellites on these based on Copernicus. So you can see the drop on NO2, tropospheric NO2. On average, NO2 has been reduced in Madrid by 50%. So if we go to the measures regarding EMT, here you can see the whole bunch of them. So the first one would be about the specific procedure we have developed in order to coordinate all the actions. So a creation of a coordination committee, the coordination of this committee with all the agents involved, the Regional Transport Authority, the Security and Emergencies Departments, also the specific protocol against the outbreak, and also how to proceed in the case of any potential case and the disinfection of all our fleets, and also all the means to keep the communication with all the stakeholders. Then the second step is the adaptation of service. Initially, we kept 100% of our service because we thought, we are an essential service, and we need to ensure that people can move to work for those that need to go in person, and also for all the additional services. But of course, at the very end, we needed to adapt the services. So we have launched new bus lines connecting hospitals and the emergency hubs. We have adapted also according to the demand. We have stopped the bike sharing system and also the bike lanes to the universities and schools. The third one is it's also about all the measures for staff, for EMT staff, so teleworking for all the administrative and central office staff, keeping also safety conditions for those key positions which need to stay at the office. Workers over 60 years have been released from work, also those with previous pathologies, from face-to-face work, also eliminating as much as possible all the split shifts for bus drivers, and the personnel rooms have been closed to avoid accumulation of personnel in them, and also direct phone lines with the health and occupational risk prevention service, and also WhatsApp ways and Telegram ways. We've been the first Spanish transport operator in limiting the maximum capacity of our buses. That's the step 4. So to keep social distance, we have reduced capacity down more than 70%. So in a regular bus, only 10 people can go at the same time, and then the first rows of seats must be clear to keep also the distance with the driver. We have prohibited the cash payment, so you can only do it with credit card or the contactless transport card, also following the instructions of the Regional Transport Authority. We have intensified, this is step 5, disinfection procedures. We keep cleaning and disinfection in all the workspace as well as the fleet, with nebulization technique and with a broad spectrum disinfectant valid for 3 months, and all buses are disinfected daily. We have launched also, in terms of corporate social responsibility, new special lines attended by volunteer drivers to transfer personnel, health and emergency and sanitary personnel to hospitals. There is a group of volunteers of more than 1,247 employees, including myself, though unfortunately I'm not that useful in this topic as I'm not a bus driver. And in terms of communication, we have intensively used all the broadcast channels to inform all the users, and also internally to inform all the employees and create this kind of momentum and corporate feeling that we are trying to row in the same direction and sharing all the information and updated information. So one of the last maybe point in terms of financial aspects, the Transport Authority estimates that the drop in the income of the public transport network is about 85 million euro per month. And then in terms of shared mobility, which is also one of the topics of Solutions Plus, basically all shared mobility services in the city have stopped completely by 100%. The last company stopped service by April 1st. And the taxi fleet has reduced the service by 50%, except the Euro taxis. These are taxis which are capable to be used by people with reduced mobility, wheelchairs and that. So there is no shared mobility basically at the moment in the city, and it's been progressively since early March. The different companies have been stopping. In terms of e-scooter sharing companies, it was a mandatory order from the city council to withdraw from service. So last but not least, I'm sorry, this is the alarm, so I'm getting to an end. Lessons learned: setting a coordination team is key. The measures, the sooner the better. Cooperation among administrations and institutions. The importance of communication, being simple, clear, and using all possible channels. And regarding uncertainties, so this is just the question that I pose to myself, is which will be the position of public transport after this, and how is going to be affected? Because The truth is that right now the recommendation is to use private means of transport, and I personally wouldn't like to be public transport affected in terms of modal shift and all the good outcomes that public transport reports on provides to urban ecosystems. So that's it. I guess I've got to the end. Yeah, that's it. So you have my contact details as well. Thank you.
Thank you very much, Sergio. We have a good number of questions now, but maybe we first have Britta's presentation and then we can go through them.
Oh, okay, so a warm welcome from my side. My name is Britta Ulrich and I work for the Hamburger Hochbahn. Our department cares of innovation and changes, and these are projects like e-scooter, 5G, AI, but also we try to develop and force the organization towards new work like agile work. This is a link to the current situation because we support the organization to work remote and to introduce new working style. To let you know a little bit about Hamburger Hochbahn here in Germany, we are public owned. Our stakeholder is the city of Hamburg. We are about 5,300 employees, and our core business is on the one hand buses, on the other hand underground, but we also operate ferries because we have a lot of water here in this area. And until 3 weeks ago, we offered about 5 million people, passengers, ride in our cars, in our buses, in our subway trains. But like everywhere in the world, the numbers of passengers decreased quite a lot. If you change the slides, the next one. Right, what happened to us here in Hamburg? Of course, we all experience a lot of restriction in our daily life. We are confronted with a passing limitation like everybody else. Luckily, no curfew, and we're very, very happy about that. So when we are out in public, we have to keep the distance of 1.5 meters to the next person, like everywhere. Our supermarkets are open, even on Sundays, which is not typical for Germany because usually they are closed on Sunday, but we try to avoid panic buying. And maybe you have heard it from the press, Germans bought tons of toilet papers. Nobody knows why. What we did, it's amazing. It's a little bit weird, but it's a fun fact. So all other shops are closed, restaurants are closed, kindergarten, clubs, universities, fitness clubs, everything is closed, just everything. We are very, very happy because by now we have a very low infection rate. The numbers are from last week. Right now we have about 130,000 people who are infected by 80 million. Luckily, only 3,000 people died of corona so far. We are very, very glad that we have a lot of hospitals, we have a lot of beds. We invite sick people from other countries to come to us. It's not that high number, but also people there, I think about 300 infected people from Italy, from Spain, from France, which we try to help here in Germany. We fly them in and help them due to we have enough beds at the moment to care for also other people, or not only for us. Tomorrow, our Chancellor Merkel will tell us how we continue in the next days. I personally hope that we are going to reopen some shops, that people can go back to schools, that university will open. I think it's kind of dream, but maybe they are going to make it a little bit easier to organize our daily life, because it's quite hard work with the children at home. Everybody has to stay at home. We can go out for some sports, but still people are very emotional involved and very nervous, and you see it. Then the crime rate really increased in Germany at the moment, which happens at home and not on the street, but still. So on the next slide, I'm going to tell you a little bit about what happened to our public transport. So we still operate and offer our services. Actually, we offer even more than before, which is interesting, which is good for us. Why do we do it? Because people still go to work. They still need transportation to get to the offices. We are allowed to work remote, but not everybody can do it. And due to the low infection rate, we have so a lot of people who have to work. And we try to keep the distance in our buses and in our underground. So we increase the offer of spaces and of the riding possibilities. Also for the night, our transport on demand becomes part of the transportation network. So in some areas you can call a taxi or a MOVIA, which you might know perhaps, for almost the same price as the public transport ride cost, which is, I think, a very, very good move from our city. We had a lot of e-scooter operators here in Germany, especially in Hamburg, and they discontinue, of course. It's not like in Madrid, where the city said you have to do discontinue. Here in Germany, they're just running out of money. So all these sharing operators, I think, are facing very financial big problems at the moment. But I personally hope that they will come back, because it's very, very important for our public transport offers that we have a variety of alternatives, not only buses or underground, also transport on demand offers. So on the next slide, we show you a little bit what we do for our drivers, what we do for our employees. We care, of course, mainly for our drivers a lot. In the very early stage, we created a kind of safety zone, as you can see here on the picture. It's the same you did in Madrid or anywhere else in the world. A customer can't enter the bus by the front door. Currently, the discussion about masks and gloves is going on. We are not really convinced that it helps, but it's good for the motivation, for the drivers. It's important that they feel we care for them and they are important for us. And of course, you can't buy any tickets at the drive at the moment. And in terms of protection concerning the white-collar worker, people are allowed to work at home, of course. But again, we face a lot of problems because people don't have a laptop or they don't have a mobile phone. They're not used to work remote. So how to learn to interact, to have webinars, how to make a workshop, how to discuss problems. It's a topic people experience since 3 weeks ago. We operate, but we do not earn any money, of course not, because there are less customers than before, and we also lose per day about 700,000 euros, which is, of course, dramatically for all of us. We try to help in different ways. The organization, we set up a hotline for our drivers, for our employees, like in case you have any personal questions, you have problems, you're not in a good shape, we talk to you, we try to support you. We have established a test center for our employees close to our main office. And of course, our boards is very much participating in meetings every day, try to handle this crisis in a good way for all of us. And the last slide, please. So people are very motivated, and you can see we have a very low sickness rate, which is really, I don't know, I can't believe it. because due to the crisis, everybody think we are in a bad mood. We don't want to go to work. We are afraid of the circumstances, but still people come to work, and the rate is much lower than it was in the last 10 years, which is really amazing. It might change if anything happened in the public maybe, or if we have more confirmed cases, like we have about 30 cases at the Hochbahn, which is very, very low. But so far it's good. Strange things happen, of course. People have this buying panic of toilet paper. They also steal quite a lot of toilet paper at the moment, which isn't maybe normal, but it's strange and confusing. But so far we are all in a good mood, and we establish a kind of routine in the crisis, and kind of routine work in the crisis, which is good. Yeah. So that was the final slide.
Fantastic. Thank you very much. Okay, I think I have stopped sharing my screen. I will. Okay, so let's look at some of the questions that have been sent in by our attendees. Maybe we can start with the question that was originally posed to Mircea. So are you all already preparing for after COVID-19 period, and what are the sort of measures that will remain after the current situation, like a long-term impact that you see? Maybe we can start with Mircea and then we can go from there.
Yes, hello, can everyone hear me?
Yes.
Yeah. Yes, I think almost everyone is starting to look into how they're going to react after the worst of the sanctions will be lifted. But also I think everyone is checking the news. So largely operators will not be able to say, yes, I'm going to keep this measure or that measure, because we still don't know what will be imposed by the authorities. And to a large extent, it's a little bit of a waiting game. But on the other hand, there's a very nice example that I heard from Singapore a while ago. No, not a while ago, last week. I was in a webinar with someone from SMRT in Singapore. And they were explaining how for them, they actually take it as a measure of pride as a company, to make sure that their stations are not viewed as a place where the spread of the virus can occur, which is why they didn't they proactively took measures to further clean and to restrict access to some areas, because they said if people hear that that people got the virus within one of our stations, they're just going to stop taking the service altogether. So they're seeing that as an as sort of a bet for the future, let's say. But otherwise, many operators are waiting to see what is going to be required of them from the rules, and only afterwards will act.
Fair enough. Are there other speakers that would like to come in on that topic?
I agree with what Mircea said. So as an operator, it is still quite uncertain. So we need to wait a little bit more, and also wait until the transport authorities set the new scenario. So it's maybe too early.
Okay. There's a question from Mr. Shuyong. The question is, how is the acceptance of passengers of the imposed measures, for instance, temperature checking? Oh, we can't hear you. Yeah. Do you want to unmute yourself? should be good.
Yes, most of the Chinese passengers actually follow the government guidelines. So when passengers enter into the terminal or when they leave the terminal, it seems they are very much cooperative with our staff to help our staff members to test their temperatures. It seems no problem.
It's good to hear. I think Britta was saying the same about people in Hamburg. And so, I mean, you were also Sergio, you were also discussing the not using a card instead, sorry, not using cash, switching to card, and only 10 people can go on the buses. Is all of this, is it very well accepted by the public and users, or has there been any resistance to these quite harsh restrictions?
No, not really. People is accepting it very well.
Yeah.
Well, we are lucky because we completed the implementation of all these contactless payment systems in all our fleet recently. So we even were the first public transport operator in doing that in the Madrid region. So it's been quite easy. And also because most of the users using the public transport network are using the monthly transport card, which is a contactless card as well. So it hasn't been really a big burden for users. And in terms of reducing capacity, well, considering the dramatic drop in the number of users, it's something even which is well accepted by passengers to be able to keep this social distance. We have even put some stickers on the seats of the buses indicating which seats must be kept empty. So people is accepting it well. And also because until very recently, we have maintained the same frequency and level of service of all our buses. So there is no, let's say, inconvenient for the users in waiting for longer for the buses. So there are less people, but there are the same buses, so they don't need really to wait for much longer. If there are too many,
that answers
just on the bus.
that answers another question that was asked directly for you. How do you control the maximum capacity per bus? So you mentioned the stickers. Are there other measures in place? Does the bus driver need to count? Or
I mean, the driver counts the number of passengers. So when reaching 10, basically indicates to the next one to wait for the next bus.
Yeah. It was noted by a few of the people that Hamburg and Madrid seem to have taken slightly different approaches. Britta was saying that you actually increased the number of services, whereas despite the radical drop in users, and Sergio, you were saying that because there's less users, you provide maybe less frequent services. Yeah, the question is, what was the strategy behind this? What are the thoughts? What are the, you know, how is it balanced? Because you don't want to overcrowd the buses, obviously, and then by having too few, but then but if there's 70% less users, then it's difficult to justify having so many services, right?
Well, we have followed at all times the indications from the regional transport authority. We are just an operator, so we need to comply with their indications. Initially, the instructions were to keep 100% of the offer in order to provide a mean of transport for those people that necessarily needed to go to work or to move around. But once the reduction in the number of passengers stabilized, of course, the transport authority said, okay, let's adapt the service, maybe reducing the service in some bus lines, for instance, those going to the airport. There are no flights. So there is no activity in the airport. So what for keeping the express bus line with the same frequency? It doesn't make any sense. Or keeping the buses to the university if there is no academic activity. So we have focused on those lines which are providing a necessary service, especially connecting mobility hubs with hospitals, emergency centers, areas where there is a high concentration of labor activity, and adapting the whole network. Yeah.
Makes sense.
Yeah, and the same in so that is the stakeholder, the transport authority tells us to keep on this volume of rides and to avoid overcrowded buses. We are happy because we can deliver this, we can perform because we have such low sickness, which is good for us, but we don't know what happens if we have a higher infection rate, if we don't find any bus drivers or underground drivers. So then we can't deliver what they order. But currently we are in a very good position.
Good to hear. I think we're almost out of time, sadly. Is there any closing remarks from any of the speakers? I mean, I think we've had some fantastic insights on different ways that the crisis is being managed in different cities, both in Europe and in China. Any closing remarks before we sign off? No? Okay, fantastic. Thank you so much to all of you for being here today and for your time. As I said, this talk is has been recorded, so it will be posted online, and we'll send out the link so you can share it. Apologies, especially to Britta for the small technical snafu. But yes, thank you very much, and thank you to our attendees, and have a wonderful day.
Thank you.
Thank you very much. Have a nice day. Bye-bye.